At the organizational level, with necessary evils, we also found some interesting variants. So I'll use the example of a hospital. One of the hospitals tries to, for its pediatric patients, it intentionally creates separate treatment rooms, which are not the same place where the patient will stay. So that when a painful procedure has to be done, it creates it retains the patient's room as a safe enclave, and yet it creates a space where the doctor has fewer distractions, is better able to focus on the task, to get it done expeditiously, and to attend with his or her full focus to the patient on the receiving end of the harm. So there are certain structural, even physical attributes, and you can think of the analogy in business would be some companies, when layoffs are done, are quite tuned in to both the sequence in which it's done and the location. It's done in a private location, off the beaten path, so that someone has some privacy when they're dealing with what's going to be very difficult information to hear, life-changing information, and at the same time, from what I would call the executioner's point of view, from the manager who's asked to perform these tasks, having it in a secluded area enables them to, in fact, deliver the sort of treatment without distractions, without fear of being interrupted. They can, in fact, accord the kind of interpersonal sensitivity that they're required and asked to fulfill. From an organizational perspective as well, what we found is that some organizations have learned over time just how important it is to train individuals. And so what you see increasingly in companies is role-playing and scripts. What you see in hospitals is a lot of simulations. And increasingly, what Andy and I argue is that what we need to do at the organizational level, where I think organizations are very good at equipping people technically. Organizations are very good, and here are the mechanics, what you need to cover legally if you're going to fire someone or do a negative performance review. And let's walk through the words you're going to use in the script. What we're less adept at doing is equipping people for the emotional rush that's going to occur when I'm sitting face to face with the person and I'm now going to witness that person experiencing the harm that I've imposed on them. And equipping people to be prepared for that, because that fundamentally changes the nature of the task itself. Because now I'm absorbing a set of inputs, a set of stimuli that are changing my psychological dynamics, and they're going to change the nature of the task that I now need to perform. I sometimes liken this to the difference between learning to drive a bus. When you're learning to drive the bus in a parking lot with an instructor, and then the first day out, you're driving the bus in a raging snowstorm with a load of screaming children. It just changes. It's both called driving the bus, but it just changes the nature of the task. And what we call for is for organizations to be more attentive to equipping people, not just for how do you use the steering wheel and the brake and open and close the door, but how do you deal with the additional stimuli of emotion and challenges from the context that are likely to arise when you actually have to do the task.